Hey Capstone, I hope you're healthy out there. Today I'm going to talk to you about body paragraphs a little bit, at least the initial body paragraphs. And I'm going to start by focusing on a part of the rubric here that's worth the most points. This is number 4, and it's called Establish Argument. The question is there an evidence-based argument present, and how convincing is it? So for 12 points, and that's a lot. So if you remember that the part where you contextualize your argument and explain why your topic is important, why it matters, that's worth 5. So this is worth 12. And the question is the response clear and is it convincing? So I think what they're looking at is, for an educated reader, somebody who's not an expert in this particular field, would they be convinced by your argument, or would they have unanswered questions, maybe be skeptical about different parts, think maybe you oversimplified here and there, that you're jumping to conclusions that are not quite founded? Some of the parts of this, it's going to be logically organized, as you can see here, well-reasoned. It's going to connect claims and evidence, and the solution is going to be plausible, and it's going to be well-aligned to your particular question. So if you set out to answer one particular question about this particular problem, how well aligned is your solution to that particular problem or question? So some of the yes things that we want to get here are, is it organized well? And so if it is, the organization is often signposted or explicit. This will come through your transitions. The paragraph to paragraph continuity is going to be really important here. The commentary fully explains how the evidence supports the claim. Don't leave it to the reader to make connections in this. We're not writing poetry. We're practicing writing research, and you have to be very explicit in this. The commentary drives the argument. Alternative views are explored. They're not just mentioned. And the solution and conclusion is fully aligned with the research question. So, as I mentioned, I think an educated, non-expert reader is going to feel like they learn enough to feel confident that you are right about this particular issue. All right, so let's take a look at a couple of different papers here, a high scoring and a middle scoring today. Now, I picked this one because you'd be really familiar with it. This is the one about night shift work and how harmful that can be for people and whether or not the government should regulate it. The thesis, if you'll remember, is that overall an analysis through the economic, medical, and legal angles shows that night shifts do merit governmental regulations. These regulations will ultimately assist employers in minimizing the health risks of workers and maximizing their well-being and work efficiency. So this person's got to prove that health risks will be minimized and well-being, the workplace is going to be enhanced by doing this. All right, so diving into the first body paragraph here. The topic sentence is here. It's, she says, the health effects of night shifts holds varying consequences from job to job, but are nonetheless profound. So this person's claim is that the health effects are serious. The topic sentence does introduce a claim about the problem. There is a cause and effect relationship going on in here. So night shift work causes bad health effects. And probably what this person wants to prove is something about these health effects, maybe the causes, the causal mechanism in this paragraph. So that's exactly what he or she does. He goes on, she goes on. Most notably, night shifts directly induce sleep problems, which include fatigue, disrupted sleep schedules, and insomnia. Now notice that the writer is getting to the research right away. There's no lengthy commentary that's without any kind of research base going on here. We're diving right in, and that's what you're going to want to do too. So moving on, this is because humans have circadian rhythms that are biologically suited to daytime activity. Misalignment of these rhythms due to night work can thus give rise to sleep disorders, which consequently influence job performance. According to Giovanni Costa, MD from the University of Milan, daytime disturbances coupled with sustained wakefulness can exacerbate the sleep problems of night workers, reducing up to 4 hours of their sleep. Okay, so what this person's done here is, as we did in the IRRs, noted the credibility of the researcher that she is citing. I'm just going to refer to her. This one as a female author. She is citing here. So that's something that's going to be important. And in order not to continue to have to put Costa over and over and over again here, you can pull it in here like this. Costa further reasons that this problem is a key factor in promoting work errors, indicating that night work after the 8th hour has led to an almost exponential increase in accidents. The rise of work errors from the stresses of night shifts can have impacts on worker safety and the industry or business in concern. Now, this paragraph is a little bit problematic, and it's definitely not the strongest in the piece. There are others that are much stronger. What's wrong with this one is it goes a couple of different directions. It talks about the health consequences, and then it indicates the cause of the health consequences, but then immediately makes this leap to the increase in accidents. And I suppose that's connected, but I kind of wanted to know more about the health consequences. Now, this one will make up for that later on in the paper, go back much more deeply into this. It's a flaw in this paper, but your papers don't have to be perfect to score well. When I contrast this with the other one, the middle scoring paper below, you're going to see that this one is a lot better. Let's go on to another body paragraph. So from an economic standpoint, impaired job performance in night shifts can be situational in certain workplace environments. Now, what is nice here is that this one is going from the impact on worker safety and the way that it can impact the industry or business to a paragraph that develops that in more depth. So this is going to be an economic concern here. So it says that this is especially true for employment involving shift work. For example, in the health industry, night shift nurses often display fatigue, which can be worsened by extending or rotating shifts. Sandy Moike, I don't know, from the University of Adelaide's Department of Critical Care Medicine explains that nurses who undergo rotating night shifts are more likely to give false responses and provide inferior patient care. Although Moike substantiates that fatigued nurses correspond to patient death, she acknowledges that further research is necessary to prove a causal relationship. Now, this is kind of nice because this person is acknowledging the limitation here. The limitation of Moike's point is that, well, we need to establish causality. Correlation doesn't equal causation. More research is needed. So even though this author found that in the source, this person also admits the weakness of that particular source. That's very good because acknowledging the limitations of everything you put forward is very important. In any case, substandard performance of nurses or other healthcare employees can affect the healthcare institution's reputation and funding, as patients value a safe clinical environment in which few clinical errors are committed. Outside of medicine, the problems of night work errors are extant in jobs involving precision or manual labor. These errors have caused historical disasters such as the 3 Mile Island accident, but more relevantly, injuries and deaths. In 2003, Conrail was held liable for $52.4 million in damages from an employee death caused by another employee who was operating on only 3 to 4 hours of sleep. As companies fail to minimize employee fatigue, night workers may perform mistakes that not only risk safety in specific environments, but also cost the companies a large sum of money. Now, one thing to notice about these high-scoring paragraphs is that there's research woven all the way through the paragraph. There might be a sentence or two here and there where the writer is drawing a conclusion or making a necessary transition or connection between two sources, but overall, it's heavily dependent upon the research. which is a little bit different from some of the writing that you do probably for your English classes. I know this is a little bit different than the synthesis papers that I teach. Okay, last paragraph I'm going to talk about today. This is nice because this is absolutely necessary, is to tackle counterarguments and rebuttals, which is what this one does here. Some experts argue that there are effective treatments to sleep problems that can help night workers stay alert, such as exercising regularly and using stimulants at a sparing level. Okay, so this is classic counterargument setup. Some experts argue. Now, we don't just say that some experts do, we actually cite an expert who does, because this is research. Sleep expert Tina Waters also notes that night workers can practice good sleep hygiene to maximize resting time. Now, here comes the rebuttal. However, these methods ignore the time constraints attributed to many night workers and do not sufficiently alleviate their circadian disruptions. For example, sleep hygiene can be rendered less effective due to daytime disturbances, as mentioned previously by Costa. An unbiased study conducted by the Cochrane Work Group also shows that the use of stimulants and medications on night workers can produce side effects, notably headaches and nausea. The limited efficacy of these treatments means that although night workers can seek temporary relief for their stresses, they are still subject to the long-term health risks of circadian misalignment. Okay, so this is really nice because this person has brought in a sleep expert, sleep researcher, and then used other studies to rebut that sleep researcher's overly simplified claim about how night workers can just manage themselves better and solve this problem for themselves without having to apparently rely on government regulation. So, this is a little bit weak here by just saying an unbiased study. I'd like to know a little bit more about who the Cochrane Work Group is, but this is pretty good. Obviously, this is a high-scoring essay, so let's move on to one that didn't do so well. In fact, I'm going to pause here and start a new one of these, and I will deliver the critique of this one in the next screencast-o-matic.